Hey guys, I'm Siobhan, a second-year medical resident. As you know, before becoming a doctor, I was a professional violinist. And so I would be performing and then getting feedback, and that's how I would improve. But as a doctor, the weird thing is that we rarely get feedback from patients. So in a previous video, I asked you guys, what do doctors do that annoys you? And I got so many replies and videos and comments, and I just want to thank you all for contributing. And so today, we're gonna see what you had to say. So first we've got a video from Annalisa.
Hi, my name is Annalisa. I'm from New Zealand, and one thing doctors do that can sometimes annoy me as a patient is perhaps when they provide more of a one-size-fits-all approach to healthcare. I think it's really important for doctors and all healthcare professionals really to actively involve patients into treatment plans and to tailor care to the individual circumstances of each patient. Love to hear your thoughts on this. Thanks, bye.
First of all, it is so great to actually see you guys. I love reading your comments, but this is just one level better. Annalisa, I really like how you called it a one-size-fits-all approach. And we've all been shopping and looked at a tag that said one-size-fits-all and kind of had that moment thinking, is that really gonna work? I think it's similar with doctors, where there's a clear link between how doctors communicate and whether it's going to work for the patient. Is that going to work for them, and are they going to follow through? So a good example is if I prescribe a water pill to one of my patients and I think, great, I've done a great job, it's going to help their heart failure, and I pat myself on the back. Well, if the patient doesn't take their medication, that's not helpful to anyone. So if they're up all night peeing and so they decide I'm not taking that medication, I need to know about that so that we can make a plan together that's actually gonna work. Of course, there are lots of other things that are involved with patient adherence, like the healthcare system, the disease, the treatment, socioeconomic status, all of that. But those are really hard to change and sometimes aren't possible to change. So we can at least work on our communication. So the take-home point is, actively involve patients in their treatment plan. So next is a video from Carly.
Hi Siobhan, I have a very complicated case of Crohn's disease, so I've been spending a lot of time at doctor's appointments and procedures and all that good stuff that comes along with it. Yeah. So thankfully now I have a really good medical team, but I think that the number one thing that bothers me the most about doctors is doctors who don't listen to the patient's concerns and feelings. They just kind of rush you in and out of your appointment because they got to see their next patient. But especially here in Canada, sometimes we have to wait months to get in to see our specialists. So that 5-10 minutes that they spend with us is huge. So I think that's my number one thing that bothers me the most is doctors not listening. You just need to listen to the patient because we're the ones that are suffering with it, unfortunately. And we really rely on you and your knowledge to help us.
Thank you so much for sharing that, Carly, and I'm really happy to hear your Crohn's is better under control. When you were talking about patients not feeling heard, it reminded me of this study that was published in the Journal of General Internal Medicine. They looked at when patients came into a clinic setting, how long could the patient talk before the doctor interrupted them or interjected? And this was a fairly small study, so it doesn't represent all doctors. But they found, on average, it was only 11 seconds. 11 seconds! That's crazy! That's so little time. I know this is definitely being addressed in medical school because when I was in medical school, we were always told to ask open-ended questions. So I usually start with, what brought you in today? Although sometimes that doesn't work because in the emergency department, I sometimes have patients look at me kind of confused and then say, the ambulance. I'm like, oh gosh, that's not what I meant. But in all seriousness, once patients start talking and telling you their story, you get so much information. And sometimes you hear things that maybe you weren't gonna ask about. But it really is a skill to learn to actively listen, especially when you know there's patients waiting, maybe your pager's going off, you're getting a text to come to a meeting, you've got your attention being pulled all over the place. And I've got some wonderful mentors that I've watched who can just give their attention to a patient. They get all the important information and the patient feels heard in a short period of time. And I'm still working on that skill. So the take-home message is, actively listen to your patients. So next we've got a video from Emma. Let's see what you've got to say, Emma.
Hi Siobhan, I'm Emma and I'm from the UK. The things that doctors do that annoy me slightly is when they come across slightly judgmental if you come to them with an issue and there's a bit of judgment there. I think that prevents you from being like honest with the doctor, as you're too concerned about what they think about you rather than like you're an issue and how you can get better. So I think that prevents like a proper doctor-patient conversation.
Aw, Emma, I'm sorry to hear that you would ever feel judged. Being a patient can really feel vulnerable, and that's part of the challenge. I know that I have patients that'll tell me, oh, I'm so sorry, my breath smells bad, or my feet look terrible. And I wish they could see into my mind and realize that in those moments on a physical exam, I'm so focused on looking for physical findings, making that diagnosis, that I'm not even thinking about those things at all. And on top of that, the things that we see and hear on a daily basis, it really takes a lot to shock me at this point. So really, we need to create a non-judgmental environment.
The other thing is when they kind of deny how you're feeling and they say, oh no, don't worry about it, it's fine. Because often I know I might be being illogical, but I need them to come up with solutions and not just say, don't worry about it, everything's going to be okay. Yeah. But I get that doctors are fantastic. Most of the time they're absolutely fantastic, they work so hard, and these are just like minor complaints, and most of what they do is just to make you better. And I appreciate that, but those are the two things which kind of sometimes get on my nerves. Thank you.
Yes, the don't worry about it, it's fine. I experienced that on the other side, on the patient side, so I completely know what that feels like. I was a kid, I had back pain, and I went to the doctor, and they were thinking it was something very serious. So when the doctor came in and told us it's fine, my parents were super relieved, but I actually left feeling kind of bad. I thought, oh, I shouldn't have complained, I've wasted this doctor's time. I didn't feel like my concerns had been validated. And in retrospect, now that I'm a doctor, I realized that we had different priorities. The doctor was worried it was a life-threatening thing, was so happy to say, you don't have to worry about it. I still had that pain and was like, what do I do with this pain? No one's addressed it. So I now realize that it's so important to realize where the patient's coming from, validate their concerns, and actually discuss them. So the take-home point is validate your patient's concerns because they're just as important. Okay, next is a video from Clyde.
Hi guys, I'm Clyde and I'm from the Philippines. Doctors annoy me when they don't remember the name of their patients or they don't remember what happened to them, because I have been with my doctor for so many years now and he still doesn't remember my name or what happened to me. But that's quite understandable because I know that doctors have a lot of patients to look after.
I can imagine it probably doesn't feel like you're building a trusting relationship with a doctor if they don't remember your name or what you talked about last time. That actually reminds me of a quote by Dale Carnegie, a writer, who said something along the lines of, a person's name is the sweetest, most important sound in any language. The idea being that it's so important to remember someone's name. So try to remember the patient's name and some details from a previous encounter. Alright, next we've got one from Faith.
Hey Violin MD, my name is Faith. I am from Vancouver, British Columbia, Canada, and the most annoying thing that I think that doctors do, and mind you, this has only been in America, I've never experienced this in Canada, is when they don't look at you at all. or they don't look at you in the eyeball. So I've had doctors that literally just come in and they're like, hello, my name is Dr. Smith. What are your symptoms? Fascinating, you have a stomach ache. You have a parasite. I'm going to prescribe you this medication. All right, have a great day. And I'm like, hello, my face is right here. What? Thanks for watching, Siobhan. I super appreciate you and all the stuff that you do.
Wow, I really hope that's not happening often. I mean, that's definitely not a good doctor-patient interaction. Actually, in medical school, we're taught that the very first thing in a physical exam should always be inspection. Like you inspect the person and actually look at them. I've met some absolutely incredible doctors who approach medicine sort of like a detective. So if someone came in with back pain or knee pain, they would then look at the bottom of the sole of their shoe and look at how they've been walking that might cause the pain. Or if they're coming in with lung problems, they'll be looking at their hands to see the type of work that they do, because some environmental exposures can give you some pretty bad lung diseases. So definitely make eye contact with your patients and connect with them. Okay, and last one is a video from Nellie.
So one thing that doctors do that annoys me as a patient is that they, or most of them, do avoid handshakes, and I get the hygienic reasons for that, but I just don't know why they couldn't disinfect the hands afterwards. I mean, everybody would understand that.
That's a great point, Nellie. Making eye contact, shaking someone's hand, that all has a really big impact. Although I actually run into this trouble sometimes. So when I'm walking into a patient's room, I take some hand sanitizer, I'm washing my hands as I'm walking in, and then my hands are still kind of wet and sticky before they've fully dried. And then if I'm approaching someone, I feel so awkward to shake their hand because they're thinking a doctor with sticky hands, like, what caused that? So I just think it's gross. So then I'm left thinking, is it the handshake that's the most important? Is it really giving them a lot of attention, introducing yourself well, being respectful? Are those the things that matter? And can we do that in any other way aside from a handshake? I don't know. I've got to think about it some more. Let me know what you guys think. Take-home message is that handshakes do matter. Wow, so if you look at all the issues that have been raised, like eye contact, shaking hands, listening attentively, and really validating people's concerns, I mean, these are all communication things. It just really emphasizes how incredibly important that is. So I can tell you this is being taken very seriously in medical education. And now in medical school, we actually have formal teaching on communication skills. Actually, the Royal College of Physicians and Surgeons, like one of our main regulatory bodies, came up with a framework for all the things that doctors should be doing, what makes up a good doctor. And being a medical expert, so the book smarts, is just like one little part of it. You can see there's also being a professional, a scholar, a health advocate. There's so many different parts. Now, even in our big exams, we have communication stations. So breaking bad news or educating a patient. These are core parts of being a doctor. So I truly believe that things are getting better, and that's because of patient advocates and for people changing the medical education system. I know that it's not easy to get feedback, but I truly believe that this is how we improve. So on that note, leave me a comment, let me know what you're thinking, because I love hearing from you guys. And if you want to see more videos like this, give it a thumbs up, and don't forget to subscribe so you don't miss those future videos. Otherwise, I'll be chatting with you guys next week. So, bye for now.